Hi, Liz.
Hi, Sarah.
Tell me about stool testing. Like, why do you use stool testing in your practice?
Mhm.
What's the benefit to using it? Why do you choose some tests over other tests?
Yeah, so there's a few pros and cons to it. The fancy GI map and the GI 360 are expensive. So that's the one con, I guess, that I always take into consideration is just finances, because the GI map is 500, I think, before taxes, and GI 360 550. So it's pricey, right? And if people don't have benefits, so it's not usually like the first line that I would do with anyone unless money isn't a problem. If I could do it with every patient, it would be really interesting to get a
Mhm.
good snapshot of what their microbiome. Plus, there's so much more in there that we'll talk about, I guess, in a second. So it gives you a really good snapshot, but it's not the best for conditions like SIBO, for example. It wouldn't give us a diagnosis of SIBO. And sometimes, like, let's say somebody had chronic diarrhea or really, acute symptoms after going to Mexico, for example, they would have the option of even just doing a cheaper stool ovoparasite culture and PCR test through their doctor or through us, which would be around like 65 through us. So it's way cheaper, but it's cheaper for a reason because especially the PCR piece of the testing, like basically what they're doing is they're collecting the dead bodies of all the pathogens in the stool, and then they're excreting their DNA and checking, what could be in there. And since it's so expensive, really they're just testing you for the really serious stuff if you're going to your doctor for that. But the GI map and the GI 360, they go into like 50 to 60 different types of bacteria plus. And then we're also looking at viruses, yeast, different types of parasites. So it's it dives really deep into these things, but that's why it's so expensive. And
And it's
if we were just,
quantitative, right? So we're not just getting the list of the pathogens, but we're also getting how much of each of them there are.
yeah,
Yeah.
yes, it's not just, oh, you tested positive.
Yeah.
It's telling us if we're in like the low normal range, the gray area, or it's, yeah, like if we have an overgrowth. So I like it for that. Plus, like if we were to just do like a culture,
Mhm.
that would a lot of the different bacteria, at least that would not thrive outside of the gut, as soon as they reach oxygen, they die. You wouldn't test positive for any of those species, right? So yeah, it's really comprehensive, and there's a reason for the price. But I like it for the cases, especially where they've tried so many things to heal their gut, and we just haven't gotten results, either with me or other practitioners. Or if somebody's been following like a low FODMAP diet for years and years, and they're not feeding the healthy gut bugs, we can then see, like, is it a ghost town in there? And we can run this test and truly see if things are thriving, and then we can figure out what diet would work for them. So that's really helpful. And also it can give us a glimpse if there's candida overgrowth. There's no perfect test for that. But at least it can tell us that there is candida somewhere in the intestines. Maybe not telling us if it's in the small, but it will tell us something like that. Um, do you want me to just run through all the things I like to look at, or?
Yeah, for sure. And also
Okay.
about that case that we were recently reviewing, and you were saying,
Oh,
oh,
right.
well, these bacteria are low. So that indicates that this patient has low stomach acid. So we should work in that area,
Yeah.
you know? So what
Okay.
kind of data can you get from analyzing the microbes about the actual function of the various levels of the gut?
Yeah. Okay. So going to that case, I think it was a patient who had borderline H. pylori, right? Like
Mhm.
they were in like the awkward range of not overly high, but there was some there, right? And so I think we were talking about stomach acid at the time. So certain bugs, again, Candida, Staph, Strep, those like to thrive when our immune system is shot. So I like to also look at the IgA levels on a GI map or 360, because if those are low, then those things will probably be more opportunistic and overgrow. But they also like to overgrow when there's low stomach acid, or sorry, yeah, low stomach acid. So the pH is higher because they like a more alkaline pH to thrive. So in at least the small intestine and certain parts of the colon, it should be around a 6 at the beginning, like in the duodenum. And it will get more basic the further you go through the intestines. But those ones can thrive even in the small intestine if the pH is too high. And so that could be a stomach acid issue. The GI 360 will actually test the overall pH of the stool, which doesn't tell us exactly the certain parts of the intestines, but can give us a little bit of a clue. So like we're looking at all these different clues. That person maybe had too high of strep plus low IgA plus their pH was more alkaline. Like that can maybe put together that idea that that's what's going on.
And plus their symptom picture, like what they're actually
Yeah,
presenting with and all of that.
exactly.
And do you think,
That's
what do you
what,
think the right approach is to say, okay, it looks like these species are overgrowing because the acidity is off or this enzyme isn't getting secreted, and to up that function in the digestive tract? Or do you think it's better to kill off that bacteria? Or do you do both? Like, what kind of approach do you normally take to that?
that depends, I guess, on their symptom picture, I'm thinking. So if it's like they have a lot of bloating, they have like almost a SIBO picture, then I would probably
Mhm.
do a kill off initially, but also supporting their immune system at the same time to help like really the root of it would be the guts military or the immune system is not working optimally. So now all these bugs are like overgrowing. And so if we don't heal their immune system, which could be low from chronic stress, could be low from nutrient deficiencies, unhealthy diet, whatever it may be, I think that's the true root. But in the short term, I think doing a quick kill off to at least reduce the population while then supporting more intrinsically with stress management, all of that to whatever created that ecosystem in the first place, I think would be more of like a long-term solution to their problem.
Yeah.
Um, so that's probably how I would address it depending on the person.
Totally. Yeah. Yeah.
Yeah.
The individual approach and all of
Yeah.
that. Yeah. And I remember we were talking a little while ago, you were talking about that. I think it was a camera or some sort of sampling device that is, definitely not on the market yet, but
Oh
something that may
yeah.
be available in the future that you swallow. And does it take, well, anyway, we'll see what actually comes of this. But in
Mhm.
my mind, it takes serial samples along the gut tube. So it would say, okay, in your stomach, this is the pH, this is the bacterial components that we found there. And then moving along at level 7, they would have different tiers along
That'd
the
be
way, and it
amazing.
would just like pump out all this data. So you could get like a real breakdown of the entire ecosystem of the different layers, because in a stool sample it's like we just kind of get it all, right? Like we get,
Yeah.
like you said, all the dead bodies, and then we analyze that, but we don't know who was, like, maybe there was too much overgrowth of a bacteria that's normally abundant in the large intestine, but it had crept up and was, higher than it should be in the small intestine. But because we got the whole sample at the end of the equation, then it's like, oh, that looks good. So in my
Yeah.
dream scenario, we can really go in and kind of see every single section, and we can say, aha, okay, maybe we do have to kill these guys off, but it's their population is up because of this and this. And then here we see the pancreatic enzymes are a little bit under function, so we tweak here, and it's like almost like we can go in and like renovate all of the little issues in it.
Yeah.
Whereas now we have a bit more of a global view of it, and it's better than nothing. And we do understand how the gut functions, so we can upregulate the different systems as we know them to be. But it would be really great if somehow miraculously we can get in there and just get more data, right? But with
Oh yeah.
something that you and I have learned is sometimes when we get more data, especially with gut health things, it's counterintuitive, because if the person
Mhm.
has a digestive issue that's related to a stress response, and then if they get stressed out about their digestive function and the testing and all of that, then it can kind of like flip on us, and that's not good either. So humans are
No.
complicated and gut health is complicated.
Oh. Yeah, we're doing the best with what we have, I
Yeah.
guess, with testing options right now. But I agree. I think like the future will probably bring so many more potentials to know exactly what's going on and kind of assessing if the patient is best suited for that amount of testing as well. And the moment they're
Yeah.
dealing with their stress response, right? Like
Yeah. Yeah.
yeah, I agree. Too much info can be overwhelming. And then if it's aggravating things, then that's creating a worse problem at the end of the
But
day.
in a dream scenario, like if you had to swallow a capsule, it took all of the analysis, you got all of that information, it's sent to the factory that makes you your personalized probiotic or whatever, then that would be great.
Mm.
Or if it's like your personalized yogurt culture, and then that you can perpetuate that population of good bacteria, forevermore in your daily diet. Like there's
Yeah,
a future there that's really wonderful. And
that's
and then
true.
we can have, that precise intervention for that particular patient, and they can use it as a food, dream case scenario. But then the other thing that we know about the gut microbiome is it shifts so much, right? So if you're a meat eater
Mhm.
one day and then switch to vegetarianism the next week, what's going to be in your gut, what's living there, is totally different. So the other part of it is, like really ultimately everything comes down to your diet and what you're eating. And if you're eating a prebiotic rich vegetable based diet, which may or may not include meats and whatever else, like that's really the best thing that you can do for yourself in terms of long term maintenance. You may need an assessment and intervention to kind of get you over that hump so that you can get to that maintenance phase.
Mhm.
But yeah, the test, it's so juicy to get test results, right? Because then you're like,
I
aha,
know,
this is what it was. So it
right?
makes our job easier.
It does. I feel like you need to invent that device, whatever it may be.
Yeah,
You're
yeah.
such a visionary.
Yeah, that's all I wanted to ask you about. Anything else you wanted to
Oh,
say?
okay.
Yeah,
Um, Maybe I'll quickly talk about the additional gut function tests that are included in it, just so
sure.
that I know I talked about IgA. Um, so I've been running GI 360, not as much as GI Map because it's more expensive and they're almost identical, but you get a little bit more info in the 360s. Bacteria diversity, as well as I'm just looking at a sample report here, so I'm inspired. As well as like the gut function testing. So it'll still like they both go through like the pancreatic enzymes to look if there's insufficiency there, fat malabsorption issues, they'll look into that. But I don't think the GI map looks at calprotectin. Let me just
Oh,
confirm that. And calprotectin is $160 on its own, right? So,
okay.
oh no, just kidding. They both do.
Okay.
Scratch that from the
From the
didn't
record.
want to include that. Okay, so but yes, I will mention calprotectin. If somebody is dealing with like an IBD picture and they've
Mm,
been seeing their gastroenterologist for a long time, they're working on all of the mainstream medical treatments for Crohn's or colitis or whatever that may be. This is also a good test for those people to even help optimize their health because the
mhm,
microbiome plays a huge role in inflammation in the gut too. And like if they're being monitored on their calprotectin with their gastro, that's one thing. But if they're not, like this is already included in the test too. And that's just one of like the hundreds of things we're looking at. And it saves them money if we're doing a bunch of testing anyways to do it that way. And then we can also look at gluten antibodies. We can look if there's fecal occult blood. So those are all really important for screening if there's something more serious like IBD going on. But really, like this would be helpful for any gut case if finances weren't an issue. So that's probably the biggest downside.
yeah, yeah. But you have to
Mhm.
invest in your health, right?
Yes, I
And
agree.
it's
I agree.
usually covered under extended healthcare benefits under the naturopathic coverage bracket. So,
Mhm.
that's not nothing.
No, I agree.
Mhm.
And
I have
it's not
some
like you're doing it
patients
all
who
the
maybe
time.
can't afford to do it at the time, but then they say, "Oh, my insurance is going to renew in July." I say, "Okay, no problem. Send me a message in July. We'll send you the test kit at that time." And then, the more data you can get, the easier it is for us, right? The more precise we can be with the plan. So if they are getting us that data at some point, whether it's now or in the future, like so happy to receive it when it comes.
Oh, for sure, for
Mhm.
sure. And one other thing I want to mention for the GI 360 is they'll also look at antibiotic resistance to natural antimicrobials like berberine, colloidal silver, things like that, whereas the
Okay.
GI map just looks at typical antibiotics.
Yeah.
So if somebody tested positive for like Klebsiella or something more pathogenic, then we would know they would take that sample again from the person's feces and then put it in a petri dish and try different antibiotics plus different herbs. And as
Mm.
naturopaths, of course, we have mostly the capability with herbs. So then from there, we can kind of pick a very specific treatment plan that we know would be the most likely to kill that off. Because we don't want to be waiting for months trying different antibiotics and then creating more resistance because then that makes a bigger problem. So,
People get frustrated like when things take a long time. then
Yeah, exactly.
they have to suffer with the symptoms longer, and then they're dealing with the side effects of some treatments at the same time. So, yeah, that sounds like a good
Mhm.
plan.
Yeah,
Okay,
it's all
thanks for
good.
explaining that.
Yeah. I hope that was enough, little nuggets to put in a video.
Totally. So